As a reminder, the indications for the nitro drip are severe acute pulmonary edema with a systolic blood pressure of 150 or greater or a MAP greater than 90 following the application of CPAP or BiPAP. Make sure you use the flowchart that we've been given. It breaks down the protocol super simple and it helps you adapt to your patient and their specific needs. Okay, so our patient is a 65-year-old male whose chief complaint is trouble breathing. He has a history of CHF, and you can hear bilateral crackles in all lung fields. This is our initial set of vitals. Note that his blood pressure does meet the qualifications for the nitro drip. So to start, we need to calculate our target systolic blood pressure and calculate our lower limit systolic blood pressure. It's also very important, we need to discontinue any nitro that we have already been administering. To get your target blood pressure, you're going to take your initial systolic blood pressure, times it by 0.2, and then you subtract that number you got from your systolic blood pressure. That's going to give you your target blood pressure. To get your lower limit blood pressure, you do that same thing, take your systolic blood pressure, and instead times it by 0.4, and then subtract that number that you received from your systolic blood pressure. Remember to vent your IV pump tubing. Here's a quick rundown of how to set up the drip on the pump. If you have any pump-specific questions, you can always reach out to this instructor or one of your company's officers. They should be able to help you. Make sure you're reassessing your patient every 5 minutes. Here's our next set of vitals for our patient. You can see that we did not have a significant drop in blood pressure. So if we go to the flowchart and we follow what the flowchart says, we are now to increase the drip by 5 micrograms per minute. You can see here us changing the drip from 40 micrograms to 45 micrograms per minute. Once again, make sure you're reassessing your patient every 5 minutes. You can see here that we did have a significant drop in blood pressure, so going back to the chart, we can see that we are now to discontinue the drip. A few reminders: CPAP has to be in place with this protocol. Please have ruled out an inferior wall MI with right-sided involvement. These patients are preload dependent. While it does not require a consult with a physician for initial administration, you should still consult with a physician as soon as possible. Make sure you remember to vent your IV tubing, discontinue all other forms of nitroglycerin, whether that is tablets or paste. Make sure you've calculated your target systolic blood pressure and your lower limit blood pressure. Pay great attention to the flowchart that we've been provided. That will tell you when to increase the drip or when to discontinue the drip. Reminders that your starting rate is 40 micrograms per minute and your max rate is 80 micrograms per minute. And we are not participating in the IV bolus section of this protocol.